2020 is coming to an end on an optimistic note as approved COVID vaccines are deployed.
It is such a moment of hope because we can see the light. We can see the end of this pandemic. It's the beginning of the end.
But the virus redefined the past year and left millions scarred.
I will never be the same because of this experience.
What we knew in March and February is a lot different than what we know now.
This time, last year, the virus was just beginning to circulate in Wuhan, China. As we counted down the final hours of 2019, the virus was beginning to spread.
And authorities are still baffled by the fast-spreading coronavirus that has killed at least 4 people and sickened more than 200 in China.
By the end of January, Wuhan would enter a lockdown that would last until April, but not before the virus was spreading overseas. The first case in the U.S. would be detected on January 20th.
We have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
President Donald Trump created the coronavirus task force. He praised Chinese President Xi Jinping for his transparency, and he limited travel, but did not completely stop it from hotspots abroad.
So we are officially quarantined for 14 days in Japan.
Cruise ships became floating petri dishes. Several loaded ships were stranded, sometimes with no place to dock. In February, the virus got a name, COVID-19. It began wreaking havoc in Europe. Hospitals filled, cases in Italy and Spain surged past China.
Sei in terapia intensiva, lo sai?
March 11th, the WHO finally declared a pandemic, hinting at a grim reality the US would soon face. First, an outbreak at a Seattle nursing home, then New York City.
I hate to say this, but it's true. We are now the epicenter of this crisis, right here in the nation's largest city.
Overnight, schools, businesses, and streets in the largest U.S. city emptied as state and local officials began issuing stay-at-home orders. Hospital workers scrambled to secure ventilators and beds. Americans were asked to conserve PPE for frontline healthcare workers. And the USNS Comfort docked in the city on March 30th to provide some relief for hospitals.
We're here by choice, and we have to get to work, and whatever it takes to get through our day, then we do it.
Despite dire warnings, the U.S. had enough ventilators, but throughout March, the gravity of the situation deepened. Several states declared states of emergencies. One by one, sports leagues on the collegiate and professional level suspended or canceled their seasons. On March 24th, the IOC suspended the 2020 Summer Olympics in Japan until 2021.
This is a pandemic. I felt it was a pandemic long before it was called a pandemic.
Americans were desperate for tests. Lines stretched for miles. Millions lost their jobs. In a 5-week span, more than 26 million people filed for unemployment. That's more than all the jobs added since the Great Recession. Congress passed a $2 trillion stimulus package. By the start of April, roughly 1 million COVID-19 cases had been confirmed globally. By the end of April, the U.S. had confirmed that many cases on its own, and the global death toll climbed above 200,000.
One day I had 4 or 5 patients die. It's a lot of death.
Unlike other countries, the situation has only worsened in the U.S. Peak after peak after peak of cases, hospitalizations, and deaths.
I wish everyone understood how bad this disease was, but they don't.
We had nurses work 14 days straight, whatever they had to do to help take care of all of our patients.
Our new reality, shaped by face masks, disinfectant wipes, hand sanitizer, social distancing, and the worst kind of goodbyes.
When you have a patient taking their last breaths in a bed, and you have a family member yelling through an iPad screen, trying to wake their family member up, that's something you don't forget.
2020 ends with daily deaths topping 9/11. The effort to vaccinate the country is ramping up, but for now, the year ends with the same advice: wear a mask. For Newsy, I'm Lindsay Thies.